Hi, Amber.
Hi, Andy.
So we're looking at launching this new Emotional Wellbeing Matters initiative to really support our vet colleagues. Tell us a little bit about why it's important for emotional wellbeing as well as physical wellbeing and the challenges within practice to get those best outcomes.
I think anybody who works in clinical practice is clearly very well aware that coming into the vets as a patient, as an animal patient, is stressful. And of course, there is also the aspect as well that the humans who come with that animal also find it stressful. And some of the main reasons why, if we can address that, ideally even before they step through the front door, but certainly while they're within the practice and perhaps even beyond, is that we will get better outcomes in terms of our diagnosis and our treatment plans if we take into consideration that stress level. I think the diagnosis element is important from what we can actually observe. So obviously a dog comes into the clinic and they're frozen with fear, they're maybe up on the table and they've gone quite rigid, or because they are trying to make us move out of their space because they're really nervous or sometimes painful or unwell. We might feel also the need, understandably, to perhaps use a muzzle or to use a little bit of physical restraint in order to keep ourselves and perhaps the animal and those around them safe. And then, of course, how do we actually see what's going on with them? And there are elements sometimes where that's really obvious because perhaps we're looking at a wound, but other times we want to see them move a little bit. We want to see what's uncomfortable. We want to get a true representation of how they feel. And unfortunately, stress often masks that. We're also, as clinicians, very aware that if we're doing testing, things like blood samples, that stress levels can have a negative impact on some of the parameters within the tests. And we've also got research quite recently which has shown that the humans who are associated with that animal, those the guardians of that pet, how willing they are to listen to our advice and act on that advice is affected by their perception of how the consultation's gone. And so, if they are really worried and anxious themselves about the way that their pet is feeling, so the emotional well-being of their pet, then that can have an impact on whether they follow our advice and how well they might follow our advice or buy into what we're saying. And I think, to be honest, there's been an increase within the pet ownership community of asking more questions as well about the way that we are aware of how their animal's feeling and, how having the examination might feel, and what restrictions we may or may not be putting upon them when we make certain recommendations for perhaps rest, or lead exercise or certain other treatment plans. So there's a whole host of aspects where I feel if we can recognize the stress and address it before they've even come in the room, but of course, ideally as well while they're there, has a huge impact, not only on that momentary experience for that dog, but also what the client perceives about the situation, and also what that might mean in the future when the animal comes back. Because obviously, experiences become cumulative, and many pets might become harder and harder to handle, or even just harder and harder to assess and make correct, effective treatment plans for if we don't look at that emotional well-being and address that in the moment.
And that's going to be an important part of what this initiative is about, isn't it? It's about providing more awareness, especially for the general public, and the things that they can do at home, especially pre coming to the vets, but also those post-operative times when you might have a dog, for example, or any animal that has to be kept calm or not too much animation.
Exactly, exactly. What we want to do with the initiative is not add extra pressure to the vets and the vet community because we're really busy and we know that. So, what can we do to help the vets increase awareness for the caregivers for the animal of what they can do in advance, what we can do collaboratively together in the consult room, or when they come in for a procedure? And then, exactly, when we think about that buy-in to the treatment plan, again, what can we offer people to help? So often we know we've said to people, well, please keep the wound covered, please keep them calm, please keep them perhaps restricted. And then we know we see them back 3 days later, 5 days later, and that hasn't happened. So, how can we improve that buy-in, but without in clinic having to have that individual conversation? So what we're trying to increase with this initiative, isn't it, really, is to give tools to the caregivers themselves so that they can really be able to, to achieve and undertake the things that the vet is recommending in the consultation or hospital setting.
That's great. Thank you, Amber. So, if you want to know more about the Emotional Wellbeing Matters initiative, there's more information on this page, and also you can sign up so you can find out more information when it launches. Thank you very much. Thank you, Amber.
Yeah, it's an exciting time. So I hope we hear from lots of vets about what they'd like to hear, and how useful they're finding the information within the initiative.
Brilliant. Thank you.